Angioplasty, the life-saving procedure that reopens blocked arteries and prevents heart attacks. Want to know how it works? Have you ever thought about the intricate network of highways inside your own body? I'm talking about your arteries, the vital channels that carry life-giving, oxygen-rich blood to every single part of you. Imagine these highways getting clogged, creating a traffic jam that prevents essential supplies from reaching their destination. This is precisely what happens with a condition called atherosclerosis, where a sticky substance known as plaque builds up, narrowing your arteries. It's a silent process that can lead to serious, life-threatening events like a heart attack or stroke. Understanding this internal plumbing is the first step to appreciating the medical marvels designed to keep it flowing freely. The truth is, heart disease remains a leading cause of death worldwide, but we are living in an era of incredible medical advancements. We now have procedures that can clear these blockages without the need for major open-heart surgery. Think about that for a moment. A doctor can navigate the complex map of your blood vessels, find a specific blockage and fix it, often while you are awake. This brings us to one of the most common and effective of these procedures, angioplasty. So what exactly is angioplasty? In the simplest terms, it is a minimally invasive procedure used to widen blocked or narrowed arteries. The primary goal is to restore blood flow through the artery, ensuring the heart muscle or any other organ gets the oxygen it needs. When an artery supplying the heart is blocked, it can cause chest pain, angina. If severe, it can lead to a heart attack, where part of the heart muscle begins to die. Doctors recommend angioplasty mainly to treat coronary artery disease, the buildup of plaque in heart arteries. It's often used in emergency heart attacks to quickly open a blocked artery and limit damage. It can also be scheduled electively for people with exercise-induced symptoms. By improving blood flow, angioplasty relieves symptoms and helps people return to active life. The game changer is that angioplasty is minimally invasive. Before, the main option was coronary artery bypass surgery, open heart. That means a long incision, long hospital stay, and longer recovery. Angioplasty uses a tiny puncture in the skin, usually the wrist or the groin. Often, angioplasty includes placing a stent. Let's walk through what happens during an angioplasty procedure. This typically takes place in a specialized hospital room. It's called a cardiac catheterization lab, the cath lab. The patient is usually awake but given a mild sedative to help them relax. The first step is numbing a small area of skin. Most often that's the wrist, access via the radial artery, or it's the groin, access via the femoral artery. Once numb, the doctor makes a small puncture. They insert a short hollow tube called a sheath. Through this sheath, the doctor guides a long, thin, flexible tube, the catheter, into the artery. Using live X-ray imaging called fluoroscopy, the doctor navigates the catheter. They thread it through blood vessels all the way to the heart. A very thin guide wire is passed through the catheter and across the blockage. Over that wire, a balloon catheter, with a deflated balloon on its tip, is advanced to the spot. When it's perfectly placed, the doctor inflates the balloon. The inflation pushes plaque against the artery walls, widening the vessel and restoring flow. The patient might feel a brief chest discomfort during inflation. In most modern angioplasties, a stent is then placed. A stent, a wire mesh tube, is mounted on the balloon catheter. When the balloon inflates, it expands the stent, locking it against the artery wall. The balloon is deflated and removed, but the stent remains as a scaffold. Finally, the doctor checks blood flow, removes the catheters, and applies pressure to the puncture site to prevent bleeding. For many people, the thought of any heart procedure can be frightening, but it's helpful to know what to expect. During the angioplasty, you will be lying on a table in the cath lab, surrounded by monitors and medical staff. You will be awake, which lets you communicate with the team, but you'll get medication to feel calm and sleepy. Local anesthetic at the puncture site means no pain, though you might feel pressure. When contrast dye is injected, you may feel a warm, flushing sensation that passes quickly. The most distinct feeling can come when the balloon is inflated to open the artery. At that moment, the balloon temporarily blocks blood flow, which can mimic angina or chest pain. This is expected. Tell your doctor what you feel. Immediately after, you're moved to a recovery area for observation. Nurses will monitor your vital signs and check the puncture site for bleeding. If the access was through your groin, you'll lie flat for several hours. If through your wrist, you may sit up sooner. You'll be encouraged to drink fluids to flush the dye. Most patients feel symptom improvement like chest pain disappearing, Soon after the artery opens, the next day often brings relief and renewed energy. The puncture site may be sore or bruised for a few days. Normal. Your doctor will give instructions about medications, especially blood thinners to prevent clots on the new stent. You'll get guidance on returning to normal activities, driving, working, and exercising. Recovery from angioplasty is typically much faster than from more invasive surgeries, but what you do after the procedure is just as important as the procedure itself. Your doctor will prescribe new medications, and it is absolutely vital that you take them exactly as directed. These often include antiplatelet drugs, aspirin, clopidogrel, which prevent blood cells from sticking together and forming clots on the surface of the stent. Stopping these medications too early can lead to a dangerous and sudden blockage of the stent thrombosis, which can cause a heart attack. Always talk to your cardiologist before making any changes to your medication regimen. Lifestyle changes are the cornerstone of long-term success after angioplasty. Adopt a heart-healthy diet low in saturated fat and cholesterol, reduce sodium, engage in regular physical activity, and if you smoke, quitting is the single most important thing you can do. These changes work together to prevent new blockages from forming in the future. Your follow-up care will likely include a cardiac rehabilitation program. This medically supervised program helps you recover and improve physical, mental, and social function. It typically includes exercise training, education on heart-healthy living, and counseling to reduce stress. Patients who participate in cardiac rehab have better outcomes, a lower risk of future heart problems, and an improved quality of life. It's an invaluable resource that provides you with the tools and support system you need to thrive after your procedure. Stay curious about your body and your health. Ask your doctors questions. Understand your condition and your treatments. What more do you want to learn about heart health? Share your thoughts and suggest topics you're interested in. You have the power to protect that lifeline inside you and ensure it keeps flowing strong for many years to come. It opens the door to a brighter, healthier future. And it's up to you to walk through it. If this helped you understand angioplasty, like this video to let others find it, subscribe for more clear, trustworthy health explainers, and share it with anyone curious about heart health. Comment below with your questions and tell us what videos you want next, prevention, procedures, or recovery tips.